Dr. John Brazier from Core Therapy. We're still talking about balance and looking at the whole system, how the system integrates and balances itself. So I'm going to paint you a little picture of hormone imbalance. The doctors tend to like to look at your bloods, and they'll see different imbalances within the chemicals within your blood, and they'll see hormone imbalances, whether it's from a thyroid imbalance or a thymus gland or adrenal glands or any of the whole hormonal system. When core therapists look at the body, they look at the structure and how the movement of the structure can actually affect the balance of the hormones, and also we talked about the shape of the structure. So if you can understand that each hormone gland has a particular shape, and the shape defines what it does. So we have the adrenal glands, which are a shape on top of the kidneys, and they integrate and affect different parts of the body, especially the heart, and they react to stimulus, and that stimulus comes from the sense organs, and the sense organs goes into the brain, and the brain uses the spine and the spinal cord to shoot down, and we produce adrenaline. When we're looking at the spine in particular, I'm gonna kind of try and draw you a picture here that the balance of C1, we know if there's a C1 imbalance, it will immediately affect the psoas muscles that shape your lower back, that draw the lower back in and lift the body up and really give it potent energy. If there's a problem here, we lose that power in the lower back. So actually we use the shape that is holding the kidneys and the adrenal glands in their correct position. So consequently, what tends to happen emotionally is with that change of shape and that sinking into the body, we get a change of our personality and we become quite fearful. So traditional Chinese medicine has talked about fear as the main psychological imbalance from kidney deficiency. So when the kidneys are not strong enough, then the body seems to have a lot of fear about it. So a lot of phobias about going outside or other things in the body become quite fearful. But if we pump the muscles up in the lower back that lift the body, open the heart up, what we get is a confidence change, a big growing effect. So we know that a C1 fault affects the psoas muscles. The psoas muscles hold us in this position, or one of the muscles that hold us in this position. They stimulate the kidneys. They hold the kidneys in their correct shape and the adrenal glands. And then we don't get kind of adrenal deficiency, adrenal overload. So often by changing the balance of the structure, we will change the shape and therefore the balance of the organ to produce the right hormones.